A fracture of the ilium and acetabulum presents a challenging situation to the orthopedic surgeon. One method of fixation of this fracture is to pre-contour a reconstruction plate that will fix both the acetabular and the iliofractures with one plate. This plate must be bent and twisted to the contours of the pelvis. Once the plate is in place and the fracture reduced, a screw is inserted through the most distal hole of the plate, securing the plate to the caudal-acetabular fragment. The steps of drilling, measuring the screw, and tapping are performed as with any plate, and the screw inserted. The next screw secures the cranial fragment of the acetabulum. The ilial shaft is secured in place with a screw positioned in the proximal ilium. Additional screws are inserted through the plate to provide stabilization of the fracture fragments. A minimum of 2 screws are required in each fracture segment, and where possible, 3 or more screws are used to provide stabilization. Any screw holes that lie over a fracture line should not be filled. An alternative method of fixing this type of fracture is to apply a standard dynamic compression plate to the ilium. And an acetabular plate to the acetabular fracture.